What if I told you there's a cancer we can stop before it even starts? A cancer with a vaccine, a cancer that, with early detection, is almost 100% preventable. Sounds incredible, right? Well, it's true, and yet, too many women are still dying from it. We're talking about cervical cancer. And in this video, we're breaking down how it happens, who's at risk, and what you can do to protect yourself or someone you love. So, what causes cervical cancer? It comes down to one virus, HPV. The human papillomavirus is incredibly common. Most people, men and women, will come into contact with it at some point. And in most cases, your immune system clears it without you even knowing. But here's the issue. If the infection sticks around, if your body doesn't fight it off, it can slowly cause changes in the cervix. Over 10 to 15 years, those changes can turn into cancer. But the best part, that long window gives us time to catch it early before it becomes life-threatening. So, who's at risk? Here's what increases your chances: early sexual activity, especially before age 16. At that age, the cervix isn't fully developed. Multiple sexual partners, more exposure means more chances of HPV infection. Being immunocompromised, like living with HIV, makes it harder to clear the virus. Smoking, which weakens your immune system. Long-term use of oral contraceptives, low access to healthcare or regular screening, and even this. If your husband's previous partner died from cervical cancer, it could be a clue that high-risk HPV is being passed on. But how would you know if you have cervical cancer? In the early stages, there are usually no symptoms. That's why regular screening is so important. As the cancer progresses, you might notice bleeding after sex, bleeding between periods, bleeding after menopause, or a foul-smelling vaginal discharge. And if you're experiencing pelvic pain, especially during intercourse, that could be a sign it's advanced. The good news: this cancer is preventable. Here's how you can lower your risk. Get the HPV vaccine, ideally before becoming sexually active. Delay sexual activity until your body's ready. Use condoms, especially early in your sexual life. Keep up with personal hygiene and treat STIs early. Encourage circumcision and good hygiene for male partners, because the penis can be a reservoir for high-risk HPV. And of course, quit smoking. Now let's talk about screening. What are your options? There are several effective methods to detect changes before they become cancer. Visual inspection with acetic acid, VIA, and cervicography HPV DNA testing, usually starting at age 30. Pap smears to detect abnormal cells, colposcopy, a more detailed exam if results are unclear. These tests look for early signs of abnormal cell changes, also called dyskaryosis or dysplasia. You might hear terms like atypical squamous cells, low-grade, LSIL, or high-grade, HSIL, lesions. These results help your doctor decide on the next step. And what if those early changes are found? The good news: there are several treatment options depending on the severity. Monitoring with repeat screening every 4 to 6 months. Cryotherapy or laser treatment to remove abnormal tissue. Excisional procedures like a cone biopsy. In serious cases, a hysterectomy may be necessary. But here's the most important part. Cervical cancer is one of the few cancers we can truly prevent. It just takes action. So don't wait, get screened, get vaccinated, know your body. And before you scroll away, think about this: your mother, your sister, your best friend. Could this video help protect them? If yes, share it. Because the more we know, the more lives we can save. Let's make cervical cancer a thing of the past, together.